Hello, you are listening to the Natural Healing Show for UK Health Radio. My name is Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me and my work at catherinecarrigan.com and unlimitedenergynow.com. While you're there, definitely sign up for my newsletter, which is now available on Substack. So you can learn even more about how you can heal yourself naturally. Now, our guest today is Sara Rooney. Sara Rooney is a medical herbalist, and you can find out more about Sara Rooney and her wonderful work at her website, sararooneyherbalist.com. Welcome, Sara Rooney.
Thank you so much. Again, we spoke before. This is my second time, so a real pleasure to be back with you. Thank you.
Yes. And we recently had a wonderful interview with Sara Rooney about what is adaptogens. So that's available for free on YouTube and also at the UK Health Radio website. So you can learn even more from Sara Rooney. Now, Sara Rooney, today we're going to be talking about how to heal polycystic ovary syndrome naturally. So, first of all, for our audience, what exactly is polycystic ovary syndrome or PCOS?
For a long time, it was considered a reproductive problem or issue. But as our understanding has developed, we realize this is actually a very complex endocrine and metabolic condition that affects a huge amount of women. There's a big diversity of symptoms, so that means that there's lots of different presentations. Some of the key ones are you may have irregular periods, you may have skin conditions like acne, male pattern hair loss or growth, so the two go either way. You can have weight gain. So the weight, even if you're a slim person, tends to always go round your middle. We call it the apple shape. So you may be very, very slim, but hold more of your weight around the middle. This is linked to blood sugar and insulin resistance. Um, yeah, I mean, with these issues come things like depression and low mood. We're not sure whether what causes what. And there is also a lot of issues with blood sugar regulation. So that's your metabolic health. Yeah, so there's a huge range of symptoms that come with this condition, and it's very common.
Okay. And what actually happens in the body? Why is it called polycystic ovary syndrome? What happens to the ovaries?
So this is super interesting because traditionally, one of the diagnostic criterias has been to have these cysts, lots of little cysts, when they do a scan on your ovary, and then you're determined polycystic, you have polycystic ovaries. Now, PCOS isn't just about having these polycystic ovaries, it's about having the condition. So you have to have other things that go with it. In fact, to diagnose officially for a doctor or a medic to at the moment, you have to have two out of the three following symptoms. One of them is the polycystic ovaries. One of them is lack of periods or irregular periods. And the other one is male pattern hair growth or loss. So you need to have two out of three, basically, if that makes sense. What people have got confused about, and even doctors, medics, people that I've worked with get confused about, if you have polycystic ovaries on a scan, it doesn't mean you have polycystic ovarian syndrome. I'm sure it is a bit confusing, and lots of people have been misdiagnosed with this. But we can talk more about this later. But yeah, just as a criteria, you need to have two out of those three characteristics, or yeah, to be diagnosed.
So, Sara Rooney, you are a medical herbalist. How did you get interested in the problems of polycystic ovary syndrome or PCOS?
Well, what really drove me into medical herbalism and looking at the alternative was my sister won't mind, my sister's health issues and journey with her hormones from a young girl. She really had a lot of problems and was eventually diagnosed with this condition. Um, but it meant that there were no solutions for her. There was no options. Everything she tried, she was put on the pill. She was, referred back and forth. She was, gaining lots of weight, and, it was very badly managed by the medical profession, almost like talked down about, oh, you need to go on a diet. This was in the 80s. You need to like stop eating. You're eating too much, all this kind of, and I just realized how poorly treated this was. And it set me on my journey. I wrote a paper actually. I did my dissertation on polycystic ovarian and herbal approaches. This then got asked to be published in the Journal of Herbal Medicine. And we published an article about it because I just didn't see that the conventional medical approach was giving any answers for these young women, and really quite acting very negatively in their framework and how they were speaking to people about it. So it really pushed me into really wanting to support women with PCOS in a much more holistic way.
Fantastic. So all of this was born out of your desire to help your sister. I love that.
Well, yeah, I think when you've got a passion behind something or you see what's happening in real life, it really drives you forward, doesn't it? So, I mean, hopefully I've helped lots of other women with this, but that is one of my main goals so that we can get things sorted when they're younger, because you can do things, really important things when you're young that will impact your whole life, your fertility, your, risk of cardiovascular disease. But we need to start young and educate people properly.
So, which brings me to my next question. What are the risk factors for a woman getting PCOS, polycystic ovary syndrome, in the first place? Are there any conditions that set you up for this?
Well, unfortunately, if you've got type 2 diabetes in the family, the
Mhm.
research interestingly says it often comes from the male side. So we don't know exactly understand this. So if your father or that side of the family has got diabetes type 2, interestingly as well, if there are members of the male family on that side that are prone to balding as well, they believe there's a link between that. So there's that genetic imprint. I mean, we've all got an imprint in our system, I believe, of health conditions, but I believe it is how you manage that and um, how your lifestyle affects that. But the big link between it is diabetes type 2, impaired metabolic syndrome, impaired glucose management, that can ha predispose you to this. Obviously, if your mums, your aunties as well, for if the wider family has PCOS, you're more likely to have it, definitely.
So, Sara Rooney, you mentioned that you published your dissertation about herbal approaches to polycystic ovary syndrome. And if someone wanted to read that article, where could they find it?
So it's on Google Scholar. You just type Sara Rooney, phytotherapy, and PCOS. I published it with my course leader, which was great. She was really into it all. And it's Elsevier is the journal, and it's Journal of Herbal Medicine. So um, her, herbal approaches to the management, no, of polycystic ovarian syndrome by Sara Rooney. So you just need to Google it.
Fantastic. Congratulations for that.
Thank you.
Now, my understanding is that something like 1 in 10 women actually experience polycystic ovary syndrome. What is your understanding? How many women actually face polycystic ovary syndrome?
Well, I did a little bit of research because I wanted to compare the US and the UK because different, ethnic minorities and different groups will have different occurrence of this. It's super high. It's 1 in 10 in the UK, and it's between 6 and 12% of the population in the US. So these figures are estimates, obviously. Certain Chinese populations, other populations, we don't see it as much, but there's certain South Asians seem to have polycystic ovarian syndrome a lot more. So there's variations within cultures and ethnicity. Um, and yeah, so it's a huge amount of women. But what we need to remember is this is probably a tiny bit of the people that are diagnosed, because so many women have come to me, to my clinic, with no idea they had PCOS. I had to write letters to the doctors or go, can we look at this blood test? Can we look at this? And then they got their, they just said, oh, I've never had regular periods. I've always, struggled with my weight. I'm a bit low. I've got depression. That's just how it is. And then for a lot of them, it's really empowering to know that there's something behind this and to go, right, okay, I'm just, suffering because I have this condition. I need to manage it.
So what you're saying, Sarah Rooney, is that in your professional opinion, polycystic ovary syndrome or PCOS is actually underdiagnosed.
Yes, and there's a caveat there as well. I believe the Western diet and our lifestyles is a huge issue. And I think women that maybe 50 years ago that were out working more actively, not sitting down, not eating junk food, or let's not say junk food, let's say highly ultra processed food to
Mhm.
make it more clear. High sugar, glucose, fructose syrup, all these things I believe have really like genetically and environmentally added. So if you've got this predisposition in your family to PCOS, then you start consuming all of this from a child, you're more likely to develop the stronger symptoms. That is my clinical opinion.
All right, Sarah Rooney, you are a medical herbalist and you've published your dissertation on this subject. So let's go right into it. What herbs actually help women manage PCOS?
Okay, so first of all, I'm going to say something. As a medical herbalist, every single person, you, me, if we both had PCOS, we'd be completely different. So we might give different herbs. So PCOS as well is the same thing. It's a syndrome. So some people have acne, some people don't. Some people have weight gain, some people don't. So we need to target the herbs to the exact symptom profile that you have. That's why herbs are so wonderful because we can pick a few of them, add them together and give you some personalized medicine rather than something off the shelf for one person that you and I will be very different. So let's go through them. So the traditional formulas, there's a lot of research from Chinese medicine, and they've used this incredible formula, which is a combination of licorice
Hmm.
and peony.
Hmm.
It's been very well researched, and that is very helpful to help women reduce testosterone levels because, sorry, I haven't really mentioned this. With PCOS, you're highly likely to have high testosterone levels, so that's the male androgen
Hmm.
level. So this decreases the level of testosterone in the body. And also with peony, it increases the conversion of testosterone to estrogen. So it means that your hormones are more in balance, in estrogenic balance rather than testosterone dominance. So this is a great formula. Licorice as well as anti-inflammatory, and also helps adrenally. So that's a great combination. There's lots of blood sugar management kind of herbs that are really, really well, similar to what we might use in type 2 diabetes. So cinnamon is a
Hmm.
really well researched one. Even adding, there's some research that see like half a teaspoon of cinnamon, a day can help regulate those blood sugar levels quite significantly. Um, Spearmint tea, the research on this came from the Middle East because they drink a lot of spearmint tea. It's part of the culture. And what they noticed was the men's testosterone levels were going down. So they thought, oh, that's interesting. So then we think, okay, how would this convert into someone with PCOS? So James Grant, I think his name was, did some research on this and found that actually the tea drunk twice a day was a really valuable and useful therapeutic option for women with hair growth and high testosterone. There's gymnosperma, which is a Chinese herb, another great, easy tea to have. Some of these things you just need to have 2 cups a day. It's no big deal. You're not having to take loads of stuff. You can incorporate into your food. There's a herb called Vitex agnus castus that I use a lot, but I'm going to put a caveat in here. It works really well for some women. Other women with PCOS, it doesn't. So we need to If you're really struggling with this, I suggest going to see maybe in the US you have, I think you do doctors or naturopathic doctors or a professional herbalist. In the UK, we have medical herbalists to get you started on the right way with it, and then you can kind of manage it yourself. Have you heard of reishi mushroom?
Mhm.
Brilliant evidence about that anti-androgen effect, but also its effect on the HPA axis, which we talked loads about at the adaptogen talk, didn't we? Hypothalamic pituitary axis in the brain, which controls loads of hormones, our stress response. It's like the control center in the brain. So by regulating this area, we can really affect how our hormones become more imbalanced or balanced. And these lovely adaptogens are normalizing on this axis. Just to give you some ideas, as things like reishi, ashwagandha, holy basil, these kind of herbs have these adaptogenic. So I find adaptogenic herbs really useful for women with PCOS because they're often very stressed, really low because they're struggling with this, and they need to modulate this kind of stress response to so they are really good ones. Maitake mushroom, because yeah, to add, I've done medical herbalism, but I've done postgraduate training in medicinal mushrooms. So after I qualified with the herbs, I was like, hang on, there's also all these mushrooms out here. So I do like to use a bit of a combination of both. And there's some great studies in women with PCOS, how that really helps to get ovulation back, which we is what we want, because often there's no ovulation, no periods, and can help people with their fertility as well, which is a huge issue for some women with PCOS. Not all, but some women may struggle with their fertility.
And with that, let's take a break and listen to a message from one of our commercial sponsors here at UK Health Radio. My name is Catherine Carrigan, medical intuitive healer, Amazon #1 bestselling author. We're listening to Sara Rooney, medical herbalist, and we're talking about natural healing for PCOS. We'll be right back. Sara Rooney, you and I are both practitioners of natural healing. You're a medical herbalist, I'm a medical intuitive healer. We've been talking about the herbs that help with PCOS, but what are the dietary approaches that people need to take? How do people need to change their diet if they've been diagnosed with PCOS?
Well, we touched on it straight away. Well, when we were talking earlier, I think ultra processed food is number one. So, I think we just need to realize that so much sugar, so many seed oils have been pushed into this food that we're eating. So anyone with PCOS, that's stage one before you do anything else. Get that processed food out of there. Eat whole foods, things that don't come in a package or a tray, that haven't got all this added sugar, things like that. Low carbohydrate, good quality protein, and good fats. So we're veering away from the 80s idea that you have to have diet everything with, no fat, but all sugar. Actually, we need good fats, really important. So good fats don't make you fat, it's the sugar that does. So lower carbohydrate, good quality protein. I actually think ketogenic diets can be too extreme for some women with PCOS, and it can really affect with the young women I've worked with. Sometimes it can work for like 3 months or something like that, and then they come off ketogenic and they can't sustain it. So my principle is always 80-20. You can always have something you want, yeah? If that's 20% of the time, that's no big deal. Your body will deal with it. But 80% of the time, you keep things at low carb. So when I say low carb, you can still have legumes, sweet potatoes, carrots, lentils, beans, um, things like that. But you're just avoiding the grains as much as you can, because especially processed grain, pasta, rice, things like that can actually give you quite a big sugar hit sometimes. Um, if you are going to have them, which some people feel they really need them, have a small handful amount on your hand, but have it with loads of protein, vegetables, and fiber, so it doesn't spike your blood sugar too much. Um, be careful with sweeteners, even honey and maple syrup. I know loads of people love these kind of like coconut nectar and oh, it's natural. It's still sugar. So if you've got PCOS, that will still, it's got some nice nutrients, honey, with it. It's absolutely gorgeous. It's got so many benefits, but you're still going to be having a sugar effectively. Um, and also dried fruit because fruit is sweet anyway. For example, a grape. And it's when it's a grape, it's got water in it and it's got loads of, fiber. When you suck all that water out, you've just got this bomb of sugar. Now, I'm not saying this is terrible or anything like that. I'm just saying beware about it. Some tropical fruits, if you're always reaching for mango, and bananas and pineapple, just be aware they are the ones with quite a lot of sugar. So try and go for berries. Berries are great. Kiwi fruits are good. Even an apple, I know it has got sugar in it, but it's got loads of fiber as well. So it kind of slows down how you do things. Nuts, seeds are wonderful. Um, Really try and avoid fruit juices, orange juices and things like that are just like wow. And fruit smoothies, everyone needs to be careful. Well, where you should be cautious about. But there are, blueberry smoothie with half an avocado, almond milk, some nut butter. Brilliant start to the day. A bit of protein powder if you wanted, but and that could be pumpkin seed. But basically, you're talking about protein with every meal and fiber.
I agree with everything that you said, and I want to add a couple of maybe
Yeah,
a couple
please
of
do.
guidelines. So I have many, many trainings and lots of certifications in my 32 years of experience as a in natural healing at age 66. One of them is I've studied with Dr. Diana Schwartzbein, who's an endocrinologist. And she says if you have a damaged metabolism, and if you have PCOS, you definitely have a damaged metabolism. You want to stick to a general guideline of 125 grams of carbohydrate total per day. And ideally, that would be 25 grams of carbs at five little meals, right? So, for
Yeah.
example, a slice of bread, and I think Sara Rooney and I would both agree, stay away from the bread. But to just
Yes.
give you an idea, a slice of bread is going to be about 15 grams of carbohydrate. But if
Yeah.
you go, and I agree with Sara Rooney, if you go too low and try to do no carbohydrate, that usually backfires and actually damages your metabolism more. So keeping your carbs, roughly around 125 grams per day. 150 grams per day would be for someone with a healthy metabolism. So, but don't go too low. And I like to keep everything simple. And I think the easiest way to go on a healthy amount of carbs without having to count is to just simply cut out all processed carbs and get your carbohydrates from fruits and vegetables.
Yeah. And grain, chickpeas, lentils, things like that are good sources too.
Yeah, lentils. Yes, yes, for sure. Now, what about regulating periods? Because as you know, and as you've mentioned, and we've talked about, people with PCOS often do not have their periods. So if someone has not been getting their periods, how can they get their periods back regulated?
So there is my combination of licorice and peony, which we touched on earlier. There's a herb called berberis as well,
Mhm.
which contains berberine, which we also use in patients with early stage diabetes type 2 to prevent them. It's very blood sugar regulating. So you have to think about PCOS in like, what's the cause? Like, how do we get these periods back? A lot of the time, it is this abnormal metabolism. How do we get to the root cause? We need to look at your gut health. So, berberis as well is really good at, it's like a natural antibiotic. It kills some of the bad bacteria, but encourages the growth of other ones. So, that's a really good strategy. I mentioned Vitex. I do really find this helpful with some women. I would say 80% of the women I work with, we put that into a formula, or they can take some capsules in the morning, and that can really help regulate the ovulation. We also need to give them lots of phytoestrogens. So phytoestrogens are things that we can find in foods. Like sesame seeds has got one of the highest levels of phytoestrogens. So these are plant-based estrogens that go into our receptors and say, hey, it's estrogen here. So if you're low in estrogen, it can raise your estrogen. So often women with PCOS have got low estrogen. Huge thing is cortisol. I don't know where it starts. Did you get PCOS because, you there's high cortisol in the family or genetic? Does it cause you to then have higher cortisol because you're stressed, you can't lose weight, all these metabolic imbalances? So we need to calm the nervous system and make sure that HPA axis is working in a balanced way. That's when I love reishi. That's when I love astragalus and holy basil. All these kind of herbs can come in at that point, depending on the person. There's also a lovely adaptogen called shatavari, which is she in Ayurvedic. It's she of 100 husbands. And that is basic. I love it. And it's a great libido enhancer for especially women in perimenopause and so on. But it's also really useful for women with PCOS. So I'll use that. And then we also just need to really work on the blood sugar balance, because the more balance you can get that, the more likely you are going to ovulate each month and have a period. Just to be aware, some women come to me and they haven't had a period for 6 months or so. I always say, you need to go to your doctor, you need to also have investigations. But with a woman with PCOS, they may never have a perfect, or we considered perfect 28-day cycle. It might be 35 days that we get them to, but that's fine. That's your 35-day cycle. And if it's regular, I'm much more happy with that, rather than like 1 month you have one at 20 days, the next 3 months you have nothing. So it's about finding your cycle when you've got PCOS.
So, Sara Rooney, I want to go back to two foods, soy and flaxseed. Now, my professional opinion is no one should eat soy products. And the
Okay.
reason for that is that so for example, a lot of the cheap protein powders and cheap protein bars, which again, ultra processed, are
Yeah.
made from the byproducts of soy oil processing. And
Oh, yeah.
in the US, soy is not even treated like a food crop. So it frequently gets sprayed with the worst toxic chemicals, such as Roundup. Um,
Oh, no. Is that legal in the US still?
yeah, soy is not treated as a food crop in the US. And then,
Wow.
so a lot of the soy products are made from the byproducts of soy oil processing. And so I encourage all my clients to avoid soy products. And but at the same time, when I have people with women with hormone issues, I'm very pro flaxseed because flax seeds are high in lignans and
That's correct.
high in lignans. So can you explain for our audience what is the benefits of lignans and foods with lots of lignans, such as flaxseed? How does that help
So
PCOS?
they've got a couple of, the main way is this phytoestrogenic or selective estrogen reuptake modulator is the full term. It sounds that's what we're using the term now more in this field. So basically you're using something that is going to have an effect on your own estrogen balance. So it will increase, if you're low in estrogen levels, estradiol, then it will increase it by blocking into these receptors. It also has an amazing, profile in terms of its essential fatty acids. So PCOS is an inflammatory condition as well as being a hormone imbalance. Anything metabolically out of sorts, you're going to be inflamed. So we're using natural anti-inflammatories. And it also has huge amounts of fiber, so that is great for your gut. A lot of women with PCOS have either constipation or gut issues, and that's a toxic buildup, so they need to be eliminating well and having fiber. And fiber helps to keep the blood sugar balanced because it slows how glucose is processed through the body.
Yes, and if I have any clients who have any sort of abnormal growth in their female organs, I encourage them to add flaxseed to the diet. And if you have healthy digestion, you can either use whole or ground flaxseed. If your digestion is very sensitive, I would recommend ground flaxseed. But you start with 1 tablespoon per day, and then you increase by 1 tablespoon per day up to bowel tolerance. So that usually ends up being about 4 tablespoons a day. And that definitely helps to eliminate tumors and abnormal growths in the female organs. And with that, let's take a break and listen to another message from one of our commercial sponsors. My name is Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. We're listening to Sara Rooney, medical herbalist, talk about natural healing for polycystic ovary syndrome or PCOS. We'll be right back. Sara Rooney, you mentioned that one of the symptoms of polycystic ovary syndrome or PCOS is abnormal hair growth. What can women do to reduce the abnormal hair growth?
So, one of the best ways is to manage your testosterone levels, which in turn is by modulating and managing your blood sugar levels. But the herb that I find really useful, every woman with PCOS and any kind of, extra hair growth, sometimes it's on your chin, some ladies have it on their chest or down their abdominal area. If anything like this, you should be drinking 2 cups of organic spearmint daily. And it's easy to make this. Just get the spearmint, which is a nice tasty tea. Some people say to me about teas, oh, so, I don't like that one. But this is actually really nice. You can have it hot and cold. I have it in the summertime, quite cold at times. With some ice in it, some lemon, really tasty too, but that really has a significant effect, and the research behind that is very good. So anti-androgen things like licorice as well. Licorice brings down your testosterone. So I think when we're thinking about all these symptoms, we need to get to the root cause and go like, why is this happening internally, rather than, okay, what can I put on it? Because that's not always going to be the answer. We've got to find the solutions from balancing inside.
Yes, and I want to go back to sort of basic hormone understanding for our audience. So to help you sort of rethink how do you manage your self-care. So in the body you have major hormones, meaning there's a lot of them. What are your major hormones? Your insulin, which regulates your blood sugar. And as we talked about, many women with PCOS tend to be type 2 diabetic, which means you're insulin resistant. And then on the
Right.
other side of the equation, you have your stress hormones, your cortisol and your adrenaline. And Sarah Rooney mentioned that high cortisol from being too stressed is a major factor in PCOS. So
Yeah.
the hormone that you have the most control over is actually your insulin because you get to choose what you put in your mouth. You may not be able to choose the stress that you experience in your life, but you can choose what you put in your mouth. So by regulating your blood sugar, that helps to regulate all your other hormones. And then your minor hormones are your sex hormones, your testosterone, your estrogen, and you cannot have balanced minor hormones until your major hormones are balanced. So what does that look like? you regulate your blood sugar, and you do your best to manage your stress.
To
Now,
add on to that, your insulin effects is affected by cortisol. So if you're very stressed as well, that has an effect on your blood sugar levels. So meditation, mindfulness, time in nature, breathing as well. A lot of women with PCOS, because they've got a lot of testosterone, they always go for like HIIT workouts, boot camps, running a marathon. And this actually isn't always the best thing for these women because although they think, look, I need to, keep healthy, be fit, it actually raises their cortisol, which then impacts their insulin. So they need to have a nice balance. Yes, you need cardiovascular exercise, but just, maybe don't go for the marathon training and super focus or the boot camp. Maybe try and put some hatha yoga in there or some breath work as well as maybe some strength work and, a bit of running. 20 minutes could do.
I 100% agree with everything you just said. We're in complete alignment. Now, Sarah Rooney, I know one of in addition to abnormal hair growth, another thing that bothers a lot of women is acne and PCOS. What is the best approach for the acne associated with PCOS?
I feel like I'm saying the same thing, but I believe it. It's the blood sugar. So, that is a huge. So think about your teenage boy with acne. Okay. He's like, 13, 14, and he suddenly has this huge outbreak. It's when the testosterone levels get very high. And they're eating loads of sugar, and you're like, please don't, my son. I'm like, please don't eat all that sugar, because that's just going to drive this vicious cycle. So that although, a lot of these women aren't eating loads of sugar, have got a similar effect going on there, and the insulin and the testosterone are interlinked. To add into that is your liver. So your liver processes things. It is this major organ that's detoxifying. It clears the system out of things. It's blood sugar regulating. It's amazing. So what we need to do is give you bitters, things like milk thistle, berberis, to help to clear the liver. And it's not a hard detox. Your liver goes through detoxification in 3 phases. So we need to make sure things like milk thistle help you clear all the way through. Drinking plenty of water and tea, like I spoke about, and getting to the root of the hormonal issue. Another thing that I would love to point out is this stress hormone cortisol. When you're super stressed, that can really impact these insulin levels, testosterone levels. It's like a knock-on effect, and then the skin. So some women who've been, not your typical presentation of PCOS at all, very slim, things like this, but they have this huge, horrific, like really, they're really embarrassed about it. They really don't like it. And by just regulating their stress response has brought down their blood sugar, and then we've had really good results, but it takes time. And the gut microbiome is another factor, which a lot of the gut herbs and the liver herbs work on as well.
Yes, and I agree everything. And I would also like to add another factor with acne can actually be food sensitivities or food allergies, right?
Right, 100%.
Yes, for sure. And some common food allergies that cause acne are actually sensitivity to cow's milk products. So many people find that if they cut dairy out of their diet, that their skin health improves.
Yes, I would agree 100% with that one. That, and I usually do dairy first, and if we don't get results, remember you need to keep it out for a month or 6 weeks at least. And then it would be gluten after that, which is pro-inflammatory. Obviously, you'd be checked whether you've got celiac, which is the actual, autoimmune reaction to it. But I see so many people with autoimmune or PCOS that have actually got a sensitivity to gluten, i.e., it increases their inflammation.
Yes. Now, as you know, many people with polycystic ovary syndrome don't have periods. Does that mean that they are infertile?
So they need to be investigated. I am an integrated herbalist. I work with doctors 1 day a week. I work with an amazing functional doctor team at Synthesis. And, I think we are not doctors. They need to be checked out. You know, they might need a scan to check the lining of their endometrium. We need to make sure everything's ruled out, basically. Historically, many, not the new breed of doctors that I'm working with, but sadly, in the past, a lot of them would put you on the pill at 15 or 16, which would completely stop you having your normal hormone pattern, which we've now recognized we need estrogen, we need progesterone for our bone health, for cardiovascular system. So that was the old approach. But I think now you need to get checked out. I would highly recommend looking at your diet, what you're eating, potentially going to see a herbalist or a naturopath. And what I love working with, I really love working with young girls like who've just been newly diagnosed, 15, 16, going, right, what can we do here? You know, PCOS can be a superpower. So you're different. Everyone's got superpowers from this. You just need to learn how to manage it. So testosterone means you're going to be really strong and you're going to be able to do a lot of things a lot better than other people. You're going to be, but you just need to find a different balance. And you also need to realize that, luckily quite a lot of society is realizing ultra processed food, how chemical we've made things, how much sugar's in everything. We can't continue like this. It's epidemic and it's making everyone sick. So you've got to be really strong and try and work a way out that you're not part of that system to
Now,
thrive.
Sarah Rooney, you made an interesting comment. You said PCOS can be a superpower. What do you
Yeah.
mean by that?
Well, women with PCOS have slightly higher levels of testosterone. Testosterone, those of us that are going through perimenopause, is really important. You drop your testosterone and you start to not have so much energy, so get up and go. There's lots of things like that. Historically, the concept or the idea was, you know, women with PCOS, as they became slimmer and slimmer, would become more fertile. So there's this whole idea about them being, when there was starvation going through the world, they would be the ones having the babies. So it was quite an interesting, concept anyway. Can be very much more athletic. There's lots of powers to this. And I think it's just about each one. I've got lots of women with estrogen issues, like they've got very high estrogen, and it's a very different picture. You have very slim waist, big bottom, big legs. That's the general picture of it. But there's a whole load of stuff that comes with that. So it's just about working with your own personal balance, finding out what works for you, getting some support because it's confusing and there's so much people trying to sell you stuff out there. And recognizing we're all unique. We just need to realize that's a power rather than something that, is terrible that we've been, lots of women got told with PCOS.
So, Sarah Rooney, as you know, so many times people go to the medical doctor and they're given a diagnosis and they sort of accept that, like, I have to have this condition for the rest of my life. Is it possible in your professional experience to heal PCOS?
Yes, I would say it's about lifestyle medicine. It's about you having to put more effort into things, your diet and your nutrition. But, the long-term cardiovascular implications, what makes them worse? Bad blood sugar management. What about diabetes type 2? Just because that's in the family, does that mean you have to get it? No, I don't believe that at all. I think you need to be more proactive. Yes. You need to do tougher things than maybe the person next to you who's very slim and never has to, can eat whatever they want all day. You have to take that approach and you have to work with your body a bit more. The same with fertility. Like I have so many women that have gone on to have babies that have been diagnosed with PCOS. Again, gestational diabetes is a sign of PCOS or pre-diabetics at time. So, we can help women by trying to manage them quite strictly with their blood sugar control. And it really doesn't mean starvation. It means having protein, fiber, and a little bit of carbs with your food. You don't need to not, these juice fasts and some women, the poor girls, they've been, coming to me starving themselves. not eating anything, and their friends are eating pizzas and all this kind of stuff, and they're much larger than these other girls. But it's about choosing the right food at the right time for them and learning.
You've been listening to the Natural Healing Show for UK Health Radio. My name is Catherine Carrigan, medical intuitive healer, Amazon #1 best-selling author. You can find out more about me at catherinecarrigan.com and unlimitedenergynow.com. While you're there, sign up for my newsletter on Substack. Our guest today has been the lovely, talented, and brilliant Sara Rooney, medical herbalist. And you can find out more about Sara Rooney and her wonderful work at sararooneyherbalist.com. And remember, if you have been diagnosed with polycystic ovary syndrome or PCOS, you can definitely get well naturally with lifestyle medicine and herbs. Thank you so much for listening, and we'll see you next time.